The NHS in Shropshire has launched its winter campaign this morning, encouraging us all to help ease the pressure on things like A and E. Well, Jess Harvey is a leading GP in the county and joins me now on the programme. Jess, good morning.
Morning. Thanks for having me on.
Yeah, thanks for being with us. What are the kinds of things that we can do that might save the NHS time and our own, of course?
Yeah, absolutely. I mean, we all know that winter comes with additional pressures in terms of healthcare because there's more bugs going around and they're more likely to spread. So what sort of this campaign really is about sort of trying to help people make sort of informed choices this winter to try and basically help us to help you. So it's just those small choices that can make a really big difference. So things like sort of self-care at home or looking at sort of going to the pharmacy to get advised using NHS 111, using the minor injuries units, and really just letting sort of the emergency department being there for exactly that sort of life-threatening emergencies. You know, there's other things that we can do as well to look at encouraging people to get their vaccinations. You know, we're starting to see spikes in flu cases. So certainly I'd really encourage anybody who's eligible for their flu vaccination but hasn't had it yet to get that, because it's an invaluable thing to have and just to protect you against that. It's just really important, really, because wind does bring extra pressures for NHS services, and if we can get people into the right service, it means that they get faster care, and also it helps the NHS to have sort of to be seeing the right people in the right places. So that's why it's really important.
So things like pharmacists, minor injuries units, getting stuff over the counters for colds, that kind of thing.
Yeah, absolutely. Like our pharmacies are a fantastic service, and they are able to help with sort of coughs, colds. They can help with sort of urine infections, rashes. There's a whole host of things that they can help with, and I'd really encourage patients to look for those alternative sort of ways to be seen. But I guess the other thing is wanting to reassure patients that if they do feel that they need to be seen, whether it's at a pharmacy, GP, or the emergency department, that they can present there, and we will be there and ready to help them as best we can.
You mentioned flu. We're hearing this could be a particularly bad winter for flu. Is that what you're finding?
Certainly, if you look at the statistics, is that the cases of flu are starting to increase, and it's a really difficult thing to predict the future. But certainly, as if we're starting to see cases already, then as we go into winter, particularly when we go into the social period of over Christmas, is that's when more bugs get spread because we're inside, seeing lots of people that perhaps we wouldn't normally see. So sharing those different types of bugs that perhaps we're not immune to, and certainly that's when we start to see those peaks. And I guess my real plea here would be that if you're eligible for your flu vaccine, then please get it, because you're not only protecting yourself, but you're protecting those around you who also, I'm sure, don't want to have to be getting flu, because it can cause certain people, to be really, really ill. And I'm sure, any of your listeners that have had it probably don't want to have it again. So it's just a case of trying to do those things. But then the other things that people can do to help are sort of keeping basic medicines at home. So, just those sort of like painkillers or, sort of cold remedies, those sorts of things. Because the problem is once you get sick, then the last thing you want to do is leave your house to go and get them. So having those there and ready is a really big thing as well.
As a GP, how do you prepare for the winter?
Well, I guess professionally, we try and make sure that we've got the right cover in the right places, and certainly, it's a case of ensuring, we know that we tend to see a bit of a peak around Christmas and afterwards, so it's making sure that us as a practice are prepared for that. We sort of, I've had my flu vaccine. I'm eligible for a COVID vaccine, so I've had that as well. So, we look to be protecting ourselves, and that's not necessarily for a selfish reason. It's because if I go off sick, then my colleagues aren't going to be very happy, and our patients won't be happy because things will get cancelled. So, so in terms of that, then that's how we do it. Myself personally, yes, I've got sort of cough and cold remedies that are sat there ready and waiting to go, because as I say, it's the last thing you want to do is go out and get anything. And it's just a case of we want people to be able to enjoy their lives. But it's just we need people to also try and help us, because it's a real challenge going into this period of winter as a sort of healthcare professional. And I guess the one thing I'd also just encourage people to try and be is as kind as possible, because that person that you're talking to, be it a receptionist, a nurse, a physiotherapist, a pharmacist, whoever it is, are honestly trying their best to help you. And I appreciate that sometimes it might take longer, or you might feel frustrated with various issues within sort of the whole system. But those people really are there they're doing their best, and often in difficult circumstances. So please just be patient and kind with them.
Jess, before you go, just wanted to touch on Friday. We're expecting resident doctors, or junior doctors as they used to be known, to go on strike. What advice would you have for the public about that?
Yeah, like I can imagine that people sort of hearing about that would be concerned about the upcoming strike. But I think the most important thing to emphasise is that the services will continue to run, and unless you've been contacted to say that there's been any alteration in your appointment or whatever it is you're due to have, then please attend as normal. You know, all the services will still be available. You know, GP practices will be open, pharmacies, NHS 111, everything will be there to continue as normal. So please attend an appointment if you have one, unless you've been contacted. Please use I guess just use those services like I've just described, in terms of thinking where it is that you are best, that you really need to be going. Like, do you really need to be going to the emergency department, or could it be something that you go via 111 and then to the emergency care sort of centre? So just encouraging people to do exactly what I've been going on about the whole time, really, is just to think which service you want to use, and just be reassured that your healthcare system is definitely there and prepared, and will be operating to continue giving you great healthcare.
Thank you as always, Jess, for joining us on the programme. Jess Harvey, leading GP in the county. The NHS in Shropshire launching its winter campaign.